Hello everyone, and welcome to APTA's discussion with the Student Assembly leadership on how the physical therapist brand provides a foundation for professionalism and interprofessional professionalism in physical therapist practice. My name is Jody Frost, and I'm the lead academic affairs specialist at the American Physical Therapy Association. Let us now first introduce our distinguished group who will be presenting and talking with us.
Hi, my name is Sammy Letizio. I'm the Student Assembly Director, and I'm a recent graduate from the Simmons College DPT program.
Hi, my name is Colleen Sullivan. I'm the President of the Student Assembly Board of Directors. I'm a recent graduate of Arcadia University in Philadelphia.
Hi, I'm Lizelle Pilgrim. I am the Secretary of the Student Assembly Board, and I am a third-year student at University of Medicine and Dentistry, jointly sponsored by Rutgers Camden.
Hi, my name is Chukwuemeka Wigwe. I serve as nominating committee member on the Student Assembly Board of Directors, and I'm a recent graduate from the University of Medicine and Dentistry of New Jersey, jointly sponsored with Rutgers Camden.
Hello, my name is Ken. I'm treasurer of the Student Assembly, and I'm a recent graduate from the University of Nebraska Medical Center.
Thank you all for joining us today. So how does professionalism contribute to interprofessional professionalism? And that's a tongue twister. Professionalism is the foundation upon which we establish our professional identities as individuals and a profession. Interprofessional professionalism further focuses on this concept by looking at how our professional roles work in collaboration with those of other health professions. The emphasis is on patient, family, caregiver-centered care and the healthcare team that provides care through communication, collaboration, coordination, and negotiation. So let's talk a little bit about how you're living out professional and interprofessional professionalism in your educational experiences.
At our program, we go through 3 installments of a professional issues class in which we dive deep into what it means to be professional. We analyze the brand behaviors, so we each develop ownership of what the brand behaviors mean to us. The educational preparation allows us to really understand our role in the clinic as a doctor of physical therapy. It also prepares us with the tools that we need to educate others on the brand behaviors. Most importantly, it allows us to really develop an understanding of what it means to be a true professional.
I also attend the same program as Emeka, and a second part of that is what we do with our clinical education. As a class, we meet prior to going out in clinics to review the behaviors, the brand behaviors, the concepts of professionalism in the clinic to kind of make sure that we are ready when we're going to treat our patients. On returning to school from our clinics, we also have a session that we do, a lunch meeting session where we talk about what has happened and how that has affected us as clinicians and what we think will improve the profession in the future.
What I have found to be really important to emphasize is not creating too casual of a patient rapport with our younger patient populations. So assuring that we still maintain ourselves as a professional even when we're working with someone who's maybe only 5 years younger or older than us. Besides that, I think it's always really important to respect a patient's time when they come into the clinic. And in that way, respecting that we should not have prolonged waiting times for our patients. That when they arrive and they leave, that it should be the same time each time they come into our sessions, just to assure that we recognize the burden it could be on their daily schedule for us not being on time.
In the clinical setting, I demonstrate the brand behaviors by first always introducing myself with my professional titles. I ask the patient or the client, have they ever received physical therapy? And if not, I take that opportunity to explain to them what physical therapy is all about and how we help restore and bring motion to life and the capacities in which we do that. And also always making sure that monitoring patient lines, making sure my documentation is thorough and flawless, because you can be in a setting where other healthcare providers rely on your documentation. If your documentation is not thorough, it could inhibit their decision making on other patients. In the community setting, I take the same approach where I educate patients, my community members, on the importance of physical therapy, what physical therapists can do to them, and why they should see their physical therapist if they have any pain, any muscle aches, or if they have any questions about health and fitness.
I think that as students, we have a very unique opportunity to use some of the professional skills that we are learning every day in our programs. And these skills are very consistent with the brand behaviors, such as learning about entrepreneurial skills and learning about how to be a professional. And that we as students can help each other and remind each other at all times that we are the brand and we're living the brand. And to go out and present ourselves as such, whether we're in the clinic or whether we're at school or with our friends. And I think that united together, we will be able to move the brand forward and make it to be the vision that has been set forth by the APTA. So we have such a unique opportunity to work together and be united in this.
The first step is for students to be aware of the resources available to them through the APTA.org webpage, specifically the Brand Beat page, in which students can find a multitude of resources that gives them step-by-step information about the brand behaviors and talking points as well. The second step is for the students to live the brand. Go out into the community, go out into the clinic, and live it. Be proud that they're in the profession and take ownership of the brand behaviors. I feel this way when they transfer their message onto other students, it's more ownership, it's more direct, accountability is there, and it shows that they're actually living it, and it's not just a selling point. It's that this is why you need to live the brand behaviors. I've lived it, and it's helped me out tremendously in the clinic and the professional world.
Now let's talk about interprofessional professionalism. As you recall earlier, we talked about that interprofessional professionalism expands upon the topic of professionalism, which we just discussed, by seeing how our roles work in collaboration with other health professions.
At my program at the University of Nebraska, they have a really neat opportunity for us to learn from each other. We spend 2 days where all the programs get together, whether it be med students, every profession that is taught at my school, and we break into small groups and we learn about each other, and we learn about the misconceptions that one profession has about another profession, and then we learn to break those down. And also at that same time, we get together and we work on patient cases, and we really get to see how we all fit together in the model of what's best for the patient. And it's a really unique opportunity for us to not only learn from each other, but to learn how to work together. And it's something that we practice throughout the rest of our time at school too, is we work together as healthcare teams and really learn how to best work in the healthcare environment.
At my program, we actually have a course that's completely dedicated to what's interprofessionalism. We have a lot of experts in the field coming in to talk to us about their specific specialties, such as vocational rehab specialists. We have lawyers coming in, physicians coming in, so that we're learning from them about what they do and how we can work together. Another part of that course is working with the DO students at our program, and we see a patient, we diagnose them and figure out where we want to go, and then we have a team meeting that's graded as well with a DO student and a social worker, and we sit and discuss that case as if it was we had just all seen this case, and we question each other about that. And then we're given feedback from them, what they liked and how they thought we explained about our profession and what we were doing, as well as we are giving them feedback on what they can do to help us as physical therapists.
My current setting right now is I'm acute inpatient in a hospital, and I know that all the different disciplines have the same major goal. We want to see our patients get better. We want them to be independent, and we want them to be safe. So what I think would help me as a PT is to know exactly how each profession, each discipline fits into that puzzle. So my piece is that I want to know that they're safe, that they can get up, they can walk around, they can move around in bed and if they need an assistive device, that sort of a thing. But that's not the goal of the OT necessarily, or the MD. And in this setting, I know that there are, all sorts of different people collaborating for the same thing. So how I get that information is a lot of times I ask for it. And being a student, I kind of have the advantage of they all know that I don't know yet. And I think that's all of our professional responsibility, is to get that down-to-earth attitude where we can say, listen, I don't know exactly what you do or exactly what your specific goals are for the patient, but if I do, either I can help you, if I get information, we can communicate, but it just helps to all have an idea of what each other does. Then when all the different puzzle pieces come together, the patient care goes a lot more smoothly.
Not only would it be helpful to know about each profession's scope of practice, but it would also be helpful to know regarding their marketing style or their brand. That information I could probably easily find on their website, like the AOTA or the AMA. And I could then share that information during my discussions with the patient, educating them on what's the role of each member of the healthcare team. Outside of that, in terms of working on functional outcome measures, it would be nice if we knew which outcome measures were being taught to different healthcare professions and that were similar to the ones we're taught in school. For example, on APTA's website in the Innovative Care Model section, there is an example of a home health agency who actually educates their nurses on how to do a timed up and go test, because that is their standardized falls risk assessment tool. I think that's an excellent example of collaboration and really working on a functional outcome measure that is easy enough that can be used by multiple different healthcare disciplines.
On my clinicals, we have a great opportunity to speak to med students nearly every day. And one of the things that I found out is that med students really don't know a lot about what PTs do. And it's really surprising sometimes what they say and how much they don't know about what we can do for the patients and how best that we can help them. So we have such a great opportunity in that those talking points to talk together and really break down and talk about what a PT can do and how the PT can best help the student. And one of the things you can do is hold an in-service. There's so many med students when you go on rotation that it's really a great opportunity to meet at lunch and just talk about what PTs can do and really start from the very beginning and the basics about what a PT is, how we help restore movement and function, and just really focus on what the med students want to learn. If they have questions, answer them, and just make sure that you start basic and then really try to encompass everything that PTs do and really show them that we can help restore function and mobility.
I very recently had a fabulous opportunity to work with some medical students from BU Med School. And so their program, what they do is after their first year, they send all of their students to work as nurses' aides for 8 weeks full time. So as part of their orientation, they had a session with PTs. And so I had a group of 10 or 11 students, and what we did was we spent about an hour talking about how to take care of patients and what PTs do. So I taught them bed mobility, I taught them transfers, assistive devices, all sorts of things. But when that time was up, I then talked to them about professionalism, interprofessional professionalism, and what we do as a profession. So one of my main things that I was emphasizing was, I don't want these people to go in and say, okay, you know, Mr. Jones, we're getting up, let's go. I want you to let them do as much as they can. We want to emphasize their mobility. We want to get them moving. And they were really interested in that, so they started asking me questions. And we sort of had this casual rapport going where they said, you're just finishing school, tell me about your program. They told me about theirs. And it's interesting to hear how much specific time they spend in each area. And it kind of gives us a chance to know that we do have a lot of knowledge that's very useful to a lot of people. When I was working with these students, we discussed things like patient-first language. They had never heard of it. I mean, granted, first year, but still, they had never heard of it. So we talked about that. We talked about mobility. We talked about how to work with the different professions respectfully and collaboratively. And it was just a fantastic opportunity to really get to know these people before they get too far in med school and think that they don't need us anymore.
Every day, not only do I collaborate with my fellow OTs and speech therapists as well as recreational therapists and our case manager, but we also hold interdisciplinary group sessions every day. So the group session isn't just doing a group session of PT. It's with a PT and a speech therapist and a rec therapist, and kind of how then we all combine our mutual goals and establish a group goal for that day that we're going to work on with all those patients.
I worked in occupational health, an outpatient, so I was at an outpatient hospital, and what we did was we treated pretty much only patients who were hurt on the job. And so it was a really unique type of a setup where patients would come in, they would see either an MD or some sort of a medical provider. They would then come directly to us. The medical provider sometimes came in and talked about them with us. Then if we deemed it necessary, they would go see nursing, they would go see OT. There were all sorts of different professionals all working together.
I would actually like to touch on some of our projects that were presented to us and other healthcare organizations who found us as an organization. The first was an invitation from the American Medical Student Association to attend a meet and greet with their Student Assembly Board of Directors and to meet them. They not only invited Physical Therapy Student Association to this event, but also the Dental Association. This was an event that ranged just under 100 people, and it was a casual event for all those to mingle and meet. Beyond that, we've been sought out by the American College of Physicians and their Council of Students to help edit a book that medical students are writing regarding healthcare reform.
We take the opportunity to spread interprofessionalism and professionalism to students is through the abta.org website, where prospective students can actually ask a question to a board member about what it means to be a physical therapist or how they can get involved in a physical therapist. And we take that opportunity, whether it's the first 5 or 10 minutes in the conversation, to educate them on the brand behaviors or what it means and how to go about and educate their community on the profession of physical therapy, in addition to giving them mentorship and ideas on how to take that first step forward and getting accepted into a PT school, and just to encourage them along the way and along the process. So it's making the most of every interaction, whether it's through prospective students, whether it's through other professionals at your campus. I share the campus with the osteopathic medicine students, the nursing students, respiratory therapists. So our common meeting place is the library. And so that's a perfect opportunity for us to get there and just talk about what each profession does and what we do. And so it's bringing my membership on the board to that conversation, but just understanding and taking value in the profession of physical therapy, what it means to, and loving the profession, and just living and spreading the brand.
It really helps to make sure that you're working as a team and remembering that you are not that one person by yourself. You're never alone. We learn to work with other physical therapists, we learn to refer out, but by learning about the other professions, we also learn that I can call upon a doctor if I think, you know what, I'm not seeing something right here. We learn about what the red flags are. So we know that we can bring that into a profession and know that we can reach out to a lot of different people and work together, all for the patient. The patient needs to be the center of our focus.
Lizelle made some excellent points, and that we are an autonomous profession, and that we don't practice in a bubble. We collaborate with every healthcare professional, and it's for the patient first. We put the patient first, and with that mindset, and encourage you to want to learn more about other healthcare disciplines, and you need to learn more about it, because your patient is going to come to you, and they're going to be seen by their primary care physician, or in multiple healthcare professions. They're going to ask you questions about your opinions on this profession or that profession. So you want to be educated in that realm of knowing what each profession does, so you can better provide and guide your patient to the best services so that they're receiving the best care.
I think that one of the primary ways I need to force myself to challenge and uphold interprofessional professionalism is not only being mentored by esteemed PTs in my practice, but also looking to be mentored by the other disciplines. I think that mentorship interdisciplinary is something we need to look forward to in our future, because that's the way that us as students and young professionals will really remember and appreciate those experiences and carry them forth in the future. I think that only so much can be taught in the classroom, and in terms of my mentors and other disciplines that I've learned from on the clinic, I've been able to really have a better understanding and more hands-on approach as to what they do when I see them in action in the clinic.
Hey, thank you all for your amazing insights, your experiences, and for sharing those with all of us about best practices in conveying information about the brand and our brand behaviors, about professionalism, about interprofessional professionalism, and interprofessional education and practice. As the Student Assembly, we are in very good hands with you in our future.